All right, so we'll call the meeting to order at 6:35 p.m.
Virtual meeting statement. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the Open Meeting Law, General Law, Chapter 38, subsection 18, and Governor's March 15, 2020 orders imposing strict limitations on the number of people that may gather in one place. This, the meeting of the Hubbardston Board of Health will be conducted via remote participation to the greatest extent possible. Specific information and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found at www.hubbardston.ma.us. No in-person attendance of members of the public will be permitted, but every effort will be made to ensure that the public can adequately access proceedings in real time via technological means. In the event we are unable to do so, despite best efforts, we will post on the town's website an audio or video recording, transcript, or other comprehensive record of proceedings as soon as possible. I was gonna say Kate had an itchy nose. So I guess the meeting minutes, I still haven't got anything from Andrea yet. I started working on them, but I guess I was a little overzealous thinking I could get them all done with the 4 kids home. So I'm just gonna keep knocking them out as we go, and I'll just get you all copies before the next meeting. If we want to call like a meeting next week just to approve them, we can. But the town administrator is supposed to be reaching out to her because we haven't gotten any minutes.
Okie doke.
And that's not supposed to be my job anymore.
Yeah, we kind of need to. We're going to be so far behind. All right, fair enough. COVID-19 and MPHN updates.
I don't have any MPHN updates. I haven't heard anything from our public health nurse, but our numbers are rising. We were sitting steady at like 1 or 2 cases, and now we are, as of this morning, had 7 active cases from 3 different households.
Wow.
Mm-hmm.
I want the B1 is here.
Yep.
It's in the area. I've got cases popping up with it.
Judy, the Pfizer vaccine that we got, does that provide any immunity against that?
Yes, as far as I know.
Okay. That's good.
It's pretty mild comparatively to the cases we first saw when people were landing in the hospital and on ventilators.
Mm-hmm.
But the big difference is how rapid the spread is. That's how I could tell which cases were like, this is suspicious, is because usually there's a 3 to 5 day lapse between exposure and symptoms or testing positive. And we're seeing like 24 to 48 hours with this new variant.
Oh.
So, I had a case where a girlfriend went out with her boyfriend and they were at a baseball practice or some sort of practice anyway, and sports practice. And they were just in touch with each other, just talking to each other with masks and everything, yet within 24 hours, all 3 of them were positive.
Is this variant, are the symptoms lasting just as long?
Yeah, they're lasting 5 to 7 days. They're flu-like. They're tolerable, as much as a flu is.
But is this people that have been vaccinated or not vaccinated?
Unvaccinated are the cases I'm seeing.
Okay.
Wow, that's interesting.
Well, and people.
And Mallory, you got my note about Seth has developed a team over there.
Yeah, I was just reading it before I logged in. So
yeah, they're willing to go to any town. So they said they would do homebound.
And I emailed Seth at our clinic on the 20th. We did a home visit.
Yeah.
Did he contact you about that?
No, unless I'm there, unless I'm there in the clinic, I don't get much communication from Seth.
Okay. So we did a home visit, and for however or whatever reason that patient was never registered in our system. as getting the shot. So now he's looking for the second shot. So I emailed Seth just to see what he had to say, but I haven't heard back yet.
Oh, that shouldn't be too hard.
Mm-mm. No, because we can reopen the clinic and just add him in.
Right.
So it's not a big deal whatsoever. But he was one that we needed to get. And then I had 2 other homebound patients, but Seth had already taken care of one and they're working on the other. So
Okay. Sounds good. Does Heather said that she would be willing to be a backup, and I too can be a backup.
okay. Great. And then as far as COVID update, soccer is looking to get started. So they're going to be following the same guidelines as before. Included a copy of the email. They're just looking for a blessing from the Board of Health to get started.
Well, they said they would wear masks while they're playing on the field. And everyone there is to wear masks. So if they're all wearing their masks, then like they did in the fall, then I think it's probably okay, even with this new variant. But we probably should attach the information Judy just gave us about how quickly people get symptoms with the new variant if they're unvaccinated, and really stress the masking and hand sanitizers. That's my opinion.
Yep. Anyone else?
I don't disagree.
Yeah, I mean, I think, common sense makes sense.
Yeah. And I don't think we can say it enough times
Trust
about
me, I know. I know.
about how contagious the new variant is, how quickly the symptoms show up, and why the masking and the hand sanitizer is just an absolute necessary thing if they don't want to go home sick. So I just think we can't say it enough times, no matter what. So we'll just keep plugging it out there with every communication.
And then something to think about too is our surrounding communities are starting to open their senior centers and their town halls. So eventually, no one's approached me with it yet, but I know that it's coming because Claudia is on her way home. So we're gonna have to start looking at that too.
My thoughts on that is to do a hybrid system, which the assessors, I assume they've had their meeting now, where some of it was you could participate on Zoom and some of it was in person. So I think we need to give people the Zoom option if that's possible. I'm looking at that as a hybrid way of handling some of this.
I think that makes sense for town meetings. What about senior center?
Activities.
I mean, if the seniors are all vaccinated, what's the, are the,
And
does
also
the new state
folks that
guidelines
deliver-
address that? Oh, go ahead, Kath. Oh, go ahead.
Sorry. They get meals delivered to them. So all those delivery people that come, I'm assuming they're vaccinated, but I'd like to know 100% that those folks that do deliver food to them, the meals, that those folks are vaccinated as well. So we just, don't want to put the seniors at any kind of risk at all.
Yeah, I don't know how we could do
I
that.
don't think we can ask that.
Yeah, we can ask that Claudia, put that emphasis out there. So,
I mean,
Yeah.
it's a preference, but they're not gonna, it's not a mandatory vaccine,
Right, and we can't include or exclude people based on that vaccine because at that point it becomes discrimination, medical discrimination. Same with a lot of our doctor staff that aren't getting it, or EMS, fire, police. They're
Right.
still all responding without the vaccine if they choose
So
not to get it.
So the standing issue becomes that if we have seniors who want to gather, they still need to wear masks and they still need to socially
Oh, yeah.
distance. So there's
Right.
still a limit on how many can attend or they have to have plans for outdoors.
Mm-hmm. Yeah, social distancing and proper mask wearing, hand sanitizing, logging, keeping all the information for contact tracing if needed needs to still apply.
Yep.
Mm,
Yeah,
But no one's approached me yet, and they would have to provide like an opening plan like they did last time.
Yep.
Just something to think about. I've been trying to keep an eye on other towns that are opening and seeing how they're doing things, and so we don't have to reinvent the wheel.
Okay. Anything else? Any other conversation from the board? I'm sorry, I'm half asleep today.
I'm with you.
There is guidance out there for reopening, 25 people, whatever.
Mhm.
There is guidance, and it's all brand new, like within the last week. So maybe we can track all that down and just make it available to anybody that's thinking about opening up anything in town. But again, it continues to be very fluid, and what was okay yesterday is not okay today. What was not okay today will be okay tomorrow. So, but if we can track that down, that may, and offer that as guidance. These are from the governors. This is coming off the state site, and this is what we recommend you follow.
Okay.
I've got a final comment if we're through with all the other business on COVID that I'd like to make. Kate, we ready for this one?
Sure.
Okay. I think that at my readings of all the information I've seen in town with the Hubbardston People Facebook, the town website that we've had, I have yet to see any mention about the two clinics that we've held. Maybe somebody can correct me, but I haven't seen anything. And therefore, I would like to make mention to all our vast number of listeners and viewers out there in TV land, the fact that I think particularly Judy O'Donnell and Mallory, Kate, Colleen, and Kathy, Dr. Stouter, Dr. Prentice, and Seth Knight from Rutland did one great service to the town of Hubbardston. I think we all deserved a great pat on the back, but I have not seen a gathering in the town of Hubbardston in the 30 years that I have been here where so many people were smiling and happy and glad to see each other. In spite of the fact we didn't see any smiles because they were wearing masks, but this was one very extremely important and efficiently run and very welcomed occasion that the Board of Health provided to the services of the town of Hubbardston. I think the Board of Health deserves a lot of credit, and all you folks did a great job.
and
And
you
I'm
too,
certainly
Vinny.
thankful I was able to get my vaccine. But I mean, I have not seen anything about that, but I think everybody needs to notice, and you may not realize this, but we have thousands of viewers every other week on this channel, and maybe hundreds of thousands, I'm not sure, but they need to know the fact that we've completed 2 of these clinics without a flaw, and there's been a lot of great people in this town that did a great service for the citizens, and I think we did a good job. So I'm pretty pleased about that. I hope we can do some more for for different age groups.
I agree. It would be nice to be able to continue with the clinics if the state changes their course.
Which they probably won't.
Well, when you think
But
about
thank you, Vinny. That was that. Thank you, and you did a great job also. But I think I follow the Hubbardston Facebook's pages, and I'm thinking that a lot of the people that follow those aren't the senior citizens. or they don't, and they don't, well, if they are, they don't participate, they just watch.
That may be true.
And because most of the people I see that participate on any groups of Facebook page, I'm on a couple of different towns, and it's usually the
Complainers.
well, I was going by the age groups, like around 30 to 50-year-olds. They are the ones that mostly put out their opinions and start a conversation, and it's not usually the over 65, 70-year-old crowd, I don't think. And that's who we were, that's who we were out there for at both of those clinics. I mean, I've seen a couple people, but nobody, yeah, you're right, nobody really commented on it, but, I wasn't like expecting to see that, but because I do follow that, now that you say that, I think that could be why. It could be just an age group thing on Facebook, I think.
Well,
I think that's probably right.
This falls right on Mallory's shoulders because she's the only one that fits in that age group.
Mallory, it's all your fault.
We might not be
I'm only kidding.
I'm not criticizing anybody. I just haven't seen anything, and I just think
I don't think that we're going to see it on social media, but we're getting the phone calls from residents and friends of our residents, and people who live in other towns who have heard from our residents how great our clinic was. My phone doesn't stop ringing. People looking to get into our clinics who know someone who attended one of ours, and people just constantly giving praises for how safe they felt and how well run it was, and definitely thanks to Judy's team and to Seth, and so people are out there talking. I just don't think it's going to be on the social media platform.
Yeah.
A lot of people who are hesitant to post on the social media platform about the vaccine because it's so controversial right now. So a lot of people are shying back so that they don't stir the pot. At least I tend to feel that's how I feel, at least.
Well, I think that if there was, I don't want to say that, I don't want to sound like self-serving here, but if there was more people talking about it, then it might get up further into the state VIPs or whatever, saying that how well the smaller town, and let's talk all towns, the smaller towns did with their clinics, and it may be a way to actually show the governor's office or somebody maybe really close to that we can do our own clinics, that we are able to do that, and that we bring in most of our, depending on what age population we're doing, we bring that in, and we can do that.
I think though too, we got to be careful, or not we, but the state is a little hesitant to allow the small towns to do it right now because there's so much going on that it's easier to streamline the large vaccine or a large amount of vaccine to these mass clinics rather than dole out smaller doses to smaller towns like us.
Well, I realize that, but some of my friends who are over 65 now, as some of us are, they got onto that new website, and some of them got to go to Leominster and around here, and they were so thankful that they did not have to go to Fenway Park or to the colleges in Boston or anywhere near, inside 495. They were able to do that out here. And I think that shows that a lot of people aren't really going to go for that huge mass vaccine platform. They just don't want to get involved in that, and they certainly don't want to drive to Boston.
Right.
I don't know.
I think part of the push from the state is, like Mallory said, was to streamline it. But the other side of it is that if you remember when we started planning this, we had a whole bunch of logistical questions about how we were going to plan for an allocated amount of doses and then roll out a website and communicate to people and get them to register to use up all the doses. And part of the solution that the state's come up with is pre-registration. And their ability to pre-register and then plan and then roll out to the larger sites. From a logistical perspective, you can understand it. I just think that it was a little short-sighted in the fact that, they've literally asked boards to prepare for this. And we have. And then it was like the rug was pulled out from under us, like literally. So I can kind of see both sides of it. And I definitely, hey, Judy figured out a camera. And I can also definitely tell you that I've heard from people who just say, you know, if I'm going to have to drive to some site 20, 30 miles away, I'm not going. So, you know, fortunately, they're at Walgreens, they're at CVS, they're at supermarkets, all of that, you know, but still, it's tough on residents who don't have access to a vehicle or, you know, are limited in their capacity to drive and all of that. So I'm glad that we're lucky enough to also have volunteers who are willing to do home visits. So hopefully we can find a way to support and assist our residents in that regard and just continue doing what we can do.
Awesome.
All right. Anything else from the board on
Quickly,
COVID?
Mallory, did that letter get sent that I had composed that people said they liked last meeting?
Yep.
Yep. Okay, great. Thank you.
All
You're
right.
very welcome.
All right, moving along the agenda. Nothing under failed systems. We have past failed Title V reports. We have 3 listed.
Yeah, so I sent those over. We have 3 that passed. All of them are going up for sale.
I could swing by maybe 2:30 tomorrow, Mallory, if you need me to sign stuff.
Yeah, I should be there.
Okay.
I think,
And
yeah,
okay.
yeah.
And does anybody on the board have questions about any of those Title Vs? Do you guys have a chance to review them?
They look fine.
Yeah, all of them done by Machete, who came in and took a look at the files and had me send over stuff to him.
Yeah, I didn't see anything bizarre about any of them. All right, moving on to water tests. Failed water, one-stop shop.
So I sent over like last week.
Mhm.
I didn't even get a report when they failed originally of the of elevated magnesium. So I guess they sent along a remediation plan as well, and we're supposed to be getting updates. So I'll forward that as they come in.
And is that for just that one shop within the building, or is it the whole building?
I think it was just the one shop. I think they each have their own filtration systems.
Okay.
If I'm understanding it correctly. So
Well, one stop, isn't that Mr. Mike's? And that is just one place.
But there's an apartment upstairs, so I wasn't sure if the residents
right.
Is that apartment occupied?
I believe the family that runs the, I think
They're living there now?
so, yeah. And they have a little boy.
Yeah, because there was some concern about the repair of that apartment. So at one point,
with the Board of Health, Judy?
it was just run down and not being well kept and was, and then it was there, then it was cleaned up and rented out, then it was empty again, and I lost track. So that's why I was asking.
It's changed ownership since then, I'm assuming.
Multiple times.
Okay.
So it looks like for, well, October, nothing November, December, January, and February, they have elevated levels. So if they've had 4 months of elevated levels, what's the board's action on that? Like, what's the next step on that, Mallory?
Well, they submitted a remediation plan. So we're going to start getting reports back on that. I guess we have to wait to see if the remediation is actually happening, if it's working.
Gotcha.
So if there was anything that would have been so elevated that would have caused a great concern, the person who did the water testing would be obligated to report to DEP as well. So I'm not an expert at reading water reports.
Right.
So I don't know. I've never had to really deal with that before, but I do know that if it was of great enough concern, it would have gone through DEP to step in.
Okay. Yeah, and I guess, I mean, like I said, I think the only question I would have for DEP is this for just the, you know, is this for the residents or this whole building or, you know,
I can do that, take care of that.
thanks.
Is that not a public water supply? Isn't it designated as a public water supply?
It's not across the street.
Well, there is one across the street,
Are
yes.
they all tied into the same?
I don't know, I don't think so. But I know commercial businesses are required to have some type of designation.
Yeah, if they're over, I think there's specific qualifications for that. Because we just had to deal with that with 56 Gardner Road and it's escaping me right now, but I can look into that too, Vin.
And they may in fact be grandfathered because they certainly don't meet the requirements for the acreage that's necessary. However,
Right.
however, standards I don't believe are ignored. I think there may be some standards, and if there's need for remediation, it probably means it should be done sooner rather than later, if in fact it is a public water supply.
Right. And they are in the process of taking care of it. So, but I'll
what was-
pose those questions.
What was elevated?
Magnesium.
Magnesium.
Hmm. I'd be more worried about iron.
Yeah. But, you know,
All of it is worrisome though, if it's enough to spark elevated something on a report. I guess maybe too, I'll start looking into seeing if there's some like a class or a seminar or something we can take on reading water reports.
that'd be helpful.
Yeah.
All right. Anything else on that before we move on? All right. Permits to be voted on. We have Kay Lashua, hauler.
He's worked in town for years, so he's just getting around to doing his permit now.
Yep. So the DBA is Bill Sewer Service. Did everybody have a chance to review it?
Looked okay to me.
And there's no tax issues or anything, right? It was signed off by the
Sign
tax
off.
collector.
Right.
Looks good to me. And this is just one that Kathy comes in and signs. Do we have to
Yeah.
vote on this one?
Yeah.
Yeah. All right. So we need a motion for
Huh.
this
I make a
hauler.
motion, we approve the Lasha hauler permit.
I second.
Colleen is second. Hold on. I'd like to take notes on these things.
No,
All right.
it wasn't me, it was Judy.
Oh, sorry. I'll tell you why I always mix your names up after this at the end, if you remind me. All right. So from the top, Vin,
Yes,
Kathy,
Yes,
Colleen,
Yes.
Judy,
Yes.
and Kate's a yes. So I do name associations to remember names, and Judy Collins is always the association in my head, so it's too close to
Jeez.
Colleen. So when I think Judy, I say Colleen because my brain is backwards and dyslexic like that. So I'd have to come up with a new. I have to think maybe you're Judy Garland, Judy.
Oh,
That way
gee.
I won't, and that way I won't mess it up unless we have somebody named Garrett or something, and then we'll be fine. But it's totally name association in my head. That's the problem. Okay. So we passed a motion on the hauler and moving on to septic with Inspector Tim Newton, 17 Elm Street repair.
Yep. So we had a tank replacement that was done, and he came in. He signed the COC. The installer got us an as-built, all that good stuff. While he was installing or inspecting the tank, he noticed some corrosion on the D-box. So the installer, Dan Mercio and Sons, just applied for their second part of the permit to replace the D-box. So Tim is working on that. And in today, we actually got 2 perk tests, one for Ragged Hill Road for a Habitat for Humanity home, and then another one on Mount Jeff for a new build. So he has already contacted the engineers and installers and made appointments to go out and see them
Awesome.
or to witness the test. Goodness, my brain is off. But so he's working well within that 24 hours that he told us that he'd be doing everything. He's almost like instantaneous when I send something over.
Nice.
I love it.
I have a question, Mallory. Are all three of those lots on Ragged Hill Road Habitat for Humanity? Just one? Okay, just wondering, because I know they all went up for sale at the same time and
Yeah, so they were town owned.
Yeah.
Two brothers bought 3 of them. Donna Warfield owns one of the ones that's conjoining, and then Habitat for Humanity. So there's going to be potentially 5 new houses up there. So I know that
The background is that, I don't even remember anymore what year it was, but there is a plan for low-income housing, moderate income housing for the town. And all of those lots were originally on that plan as targeted for moderate income housing.
yeah.
But unfortunately, this town is not one that endorses that kind of stuff. They're constantly shifting away from it, selling off land that could be used for that. And they're just not, supporting it or endorsing it.
So actually, right now, Judy, the planning board is working on getting some environmental studies done at the old gravel pits with the hopes that we're going to be able to do some low to moderate income housing project there. So
That would be good.
yeah, we'll see. They're in
It
the,
might be worth taking a look at that plan, because there were a lot of us that put a lot of time into it.
okay.
Well, just as a correction, if I may, the correct terminology is affordable housing.
Okay.
The planning board was never involved with any low income or moderate income housing projects. And this section on Ragged Hill was begun with the planning board about 6 years ago.
Yeah,
The Ragged Hill initiative was with this new planning board that went before the Board of Selectmen requesting one lot to be dedicated. And luckily they had Habitat of Humanity ready to do it. And it's a great opportunity.
mhm.
Under the state law, we have to have a 10% of our total housing as affordable, and we fall 7 or 8% short of that goal. However, I think the Affordable Housing Subcommittee under the Planning Board has done a good job so far on everything. And this is going to be the first affordable housing that we've had in ever, I think. So,
Yeah.
supported by the town, other than the elderly housing down there off of Old Princeton Road. But it's a great project. I hope it's successful. But you're right, Judy. It's a very difficult sell. And I don't mean to correct you for any other reason except that when people hear the term low income or moderate income housing, they immediately get turned off, and it has nothing to do with low income housing. And in fact, the affordable housing equations that people have to meet in order to buy these homes are fairly substantial. They're not very low. In fact, the housing market predicates what they have to sell these houses for, and they're not cheap. Let me put it that way.
No, there is a formula that has to be met, and it's not easy, but we need more housing.
We certainly do, absolutely. And unfortunately, the way the state has their formula, it becomes affordable for the first year or second year lawyer that can make that kind of a payment.
Yeah.
It's not affordable
Yeah.
for the Joe Dokes of the world, unfortunately, but that's how they've done it. So
Now, when you say the gravel pits, is that the ones on Williamsville Road?
Pitcherville.
I mean, Pitcherville, yeah. Okay. There's a number of them in town, so,
Yeah, it's where the police used to use for shooting.
okay.
It's gonna need a lot of restoration. I think that's probably where we'll end up getting involved somewhere along the line.
Yeah.
Yeah, they're just starting the environmental study, the second phase of it.
Yeah,
We'll
'cause
get
I've-
it in.
yeah,
No.
because I remember climbing all over a number of those as part of the Board of Health last time.
Yeah.
Now, are they going to have to go through a reclamation like they did down the road here on Gardner Road? I mean, on Worcester Road?
That's what
I
they're
mean,
trying to
is
figure
that
out.
like the first step to something like that?
Well, right now they're trying to figure out what is in the what's there and what would be the next steps. Is there any hazardous materials? Are we looking at any having to doing, I think it's called an E4 cleanup. I'm not 100% sure. So they're just in the very, very beginning.
Interesting.
Yeah.
Yeah, really.
Stay
Okay.
tuned, folks.
More to come. All right. So plans in review. We have 4 listed. I don't know if there's an overlap between the plans you just mentioned on Ragged
No,
Hill.
those are all. We haven't had anything new come in since then.
Okay.
Except for I think the only thing that's changed is 35 Burnshire has been approved by Matt. So that's going to be a sale of a house. The repairs will take place later in the spring. Money was escrowed for the repairs.
Right. And otherwise, they're all approved and just pending better weather and softer ground.
Yes, ma'am.
Okay. Any other questions on those from the board in terms of the 4 plans listed? All right. Hearing none. Move on. There is no new business listed. So
I guess I just have a couple
sure.
that came in are unexpected. I guess we can wait until because it came in late. But go ahead, we can keep going through.
All right. So open complaints. We have 111 Gardner Road and 248 Gardner Road, both listed as on hold.
Yeah.
Again, waiting for spring, but now that the ground is starting to thaw and we have snow no longer covering the ground, do we want to start making any tentative plans for those?
Well, I had sent in a note asking, the authorities who on those cars there to go down and kind of take a look at all that, because it seems like the cars are getting worse. They're being moved around, but they're having babies. And so we need to have somebody go down there and talk to them.
So who did you send that information to, Judy? Who do you?
The board has got to, make who is it that goes down there? Which other board is the one that goes down there and inspects for cars that are unregistered, et cetera, on property?
That would be
which
the
board?
zoning.
That would be
Zoning.
zoning enforcement officers.
Right. So we need to, again, ask them to go down and look at it all again, because I know at one point we did before the snow fell, and yet there's still,
Nothing. Yeah, because
nothing.
that's when we asked, and they started playing the game of Roland passed the buck to the police chief, and police chief passed it back to Roland. So maybe we should, or I can sit down with David Nixon, the town administrator, and him and I can approach Roland together. And if we have to approach the mayor in Gardner, I don't know how to get action.
Because at this point, the trash pile at the top of the hill is a minor piece of what's going on at the bottom of the hill. So I mean, it's getting beyond, so.
Well,
And I hate being the bad guy, but it's like this getting beyond.
I would think the Board of Health has jurisdiction not only over the trash, but any type of pollution that may be emanating from these vehicles, anything that may be impacting our aquifer, which this particular business is in. The zoning enforcement officer is in charge of all the violations, which, they're operating a business in a residential agricultural zone, and they're not using an automobile license, which they can't have because they're not zoned properly. And clearly it's a junkyard. And I think that if we want to be involved, we can go in there and make some determinations based on what we see as pollution, potential pollutions and violations to any type of rodents that may be running around with the trash, and any violation that may impact public health. So I volunteered in the past. I think
Mm-hmm.
Kathy and I were gonna go up there and do a site visit. I'm more than happy to do it again if we're ready to do it. And
Um,
come back to the board with a report.
I will have my one daughter visiting, probably around April 9th for a few days. Maybe Vinny, you and I can schedule it then, because of the personal circumstances that are going on here in my house. So if we can plan for sometime after April 9th,
I'll be
or
available.
10th, somewhere's in there, 11th, somewhere's in that time frame. You and I can go out.
No problem.
Okay. And then,
Is that an okay time frame for everybody?
sure,
Okay.
as spring approaches, and then, so it sounds like that's the first action plan for the board, and then Mallory, is there a simultaneous plan with the getting the zoning enforcement involved?
Yeah, maybe we can all schedule the same time, get everyone out there together.
That would be great.
All right, we'll shoot for somewhere's around that time.
Yeah, we'll get a better idea as it gets closer, but I'll start planting the bug. And, you know, if I feel like we're getting pushed back, then I can involve the town administrator. It gives us plenty of time.
Then at the end of the
Yeah,
day, if there's not if it's not a collaborative effort, I think the members of the board should still go walk the site and
I
write
think
up a
we'll
report.
still go if we,
Yeah.
but
Then-
yes, we can
then
reach
t-
out together, Mallory, with the town administrator if we need to.
Absolutely. Finn, do you think we should kind of put feelers out to Mass DEP, where it does sit on Aquifer, and that's gonna kind of fall under Concom, but Concom only handles the first 100 feet of the wetland vegetated border, and then DEP or DCR would take over. So do you think it'd be worth getting feelers out to them too?
I would prefer to wait for the visit. Now,
Okay.
once we have a better handle on it.
Okay.
Right, right. And
Yeah, I would agree.
And hopefully when it's not so soggy, we can go up the hill
Mhm.
without the Jeep getting stuck in the mud. And then we can check up on later on, we can check up on the trash pile.
Sure thing.
Perfect.
Okay, so they're no longer on hold. We have an action, we have an action plan in place
Yay.
as spring nears, or spring sprung.
Here,
technically.
it's sprung.
All right. Anything else on those two before we move on? All right. Old business, finance reports, food inspections, and recycle center.
Yeah.
So
I
the
sent
finance
over
reports, there were two, right?
two. One that went to the payment for 35 burn shirt, which went to Matt's revolver. And then everything else that went into our general fund split account. And then there was our annual service for MPHN bill that we need to pay, which includes our annual assessment and the nursing services. So that's all I have for finance right now. Nothing fun and exciting.
All right. The turnover report looks good, and we need a vote on the payment for the 1,600.
I make a motion that we approve that disbursement.
And I'll second that.
All right. All in favor? Kathy,
Yes.
Vin,
Yes,
Colleen,
Yes.
Judy,
Yes,
and Kate is a yes. The motion passes. All right. So a little note on MHN, I have to say, like, I think considering what all is involved, I think it's super cheap.
Yeah,
Throwing that out there.
especially if we ever encounter a global pandemic again.
Yeah,
Let me just be the first to say it's worth it.
right? Just
Oh,
we
before
were questioning it at first.
I just looked at him, I was like, thank you.
All right. Moving on to food inspections. All right. So I was able
before we
to.
go to that, Kate, are we still under new business? Or you want to go to are we on the unexpected business?
Not yet. We're on
No.
old business.
All right.
So food inspections, I was able to complete one. I've been trying to start scheduling others. A couple people weren't available, so I'll go back. I have a completed food inspection for Giacomo's that I have to give to you, Mallory.
Okay.
I'll try to drop that off. When's your next in-office day?
I'm there every day except Fridays.
Okay, I'll try to drop it off before the end of the week. And then I don't know if this is a good time to bring this up, but while I was doing a food inspection, I happened to witness something happening at another local eatery and reported it to Mallory via email and went in to see if the manager or owner was available, and they were not. So what I witnessed was two people walking into the diner with no masks on, carrying a puppy. Because, you know, as you do, bring dogs, you know, randomly into buildings. Not a service dog, a puppy. You know, they came out while I was waiting to go and inspect this other business, and you know, I went in to just see if the owner was available or the manager. They were not. There seemed to be only one person there waiting tables and probably another in back cooking, so I left it as it is. But there were also several people going in and out without masks on. So people seated, eating, drinking, no masks, fine. But people just walking in with no masks, not okay.
Right.
And this is not the first time this has happened.
No,
And
It's
there
multiple
tends,
repeated times.
yeah. So, I mean, I think I would like to write a very firm reminder to them. I would also like to recommend that we have Tim do their health inspection and a member of the board just come as a shadow. And also so that should Tim encounter any kind of pushback or there be any kind of conflict, that there's two people there, because we've had issues with conflict with these folks before. So I don't know how the board feels about that, or if you guys want to chime in, but that's how I'd like to approach their food inspection specifically.
Kate, that was already what I was going to suggest, that Tim do it. Yes, with us shadowing.
Tim is also on board for taking over, or not taking over, but helping with any food inspections and getting them knocked out for us. So we can at least get the 6 month in before June and have our first. And then he's happy doing follow-ups for the second as well. He did swing by the office to sign that COC for 17 Elm, and he just got approved to be a proctor for ServSafe exams. So he can teach the classes and he can proctor them. So to say that he's an expert in the field is fair. And he's done all the food inspections for Greenfield while working there. So he's more than experienced. But I think having him follow, if we want him to start helping, having him follow around for just to get familiar with faces is a good idea.
Okay, I can coordinate with him to schedule the ones that are outstanding currently.
Beautiful.
And then hand off to him, you know, several of them to do, and he can lead on that particular one, and I'll just
be more than happy. Remind me if you want to shoot me or remind your email, I will send his cell phone number over to you.
Okay. Let me make a note. So yeah, that was super fun. I was like, a puppy. I was just holding my head, and I called Mallory on her mobile at like 8 a.m. on a Saturday. Like, I'm sorry to disturb you, but I just can't.
Yeah.
Anyway, ow. Sorry, gotta move. All right. So the last thing here is Recycle Center under old business.
Yeah, so I don't think we've gotten an ad out for it yet. So I don't know, Kate, if you just want to plan on working the second Saturday, is it the second Saturday usually opened?
Yeah.
So if we just want to plan on doing the second Saturday, and hopefully by May we can have someone that we can kind of train.
Sure.
And that would be April 10th.
April 10th.
Yep.
And then we can start getting the word out that we are opening, and maybe we can kind of hook up. We can hook up during the week at some point and go down there and see, you know, where it's at and what we need to do.
Yeah.
To get open.
That's fine. Let me know what time and day. I'll
Okay.
email you. You can let me know what day works, and see what we need for keys, etc.
Yeah, I know all the keys were turned in. So the new administrative assistant for the select board has like a whole bag of keys.
Okay.
So we'll see what's there.
Are we hiring a new person to run the recycle center? Recycle center?
I think that's eventually the goal.
It's what?
The goal.
And will we be sending out information and hiring, or is that select board and town administrator? Who's going to be responsible for that?
The town administrator usually coordinates the advertising because that comes out of their budget, and then sits in on the interviews from past experience.
Right, and I usually sit with the town administrator for the interviews as chair.
And do we have a job description or a rec description?
All right.
Nope, we have nothing. I've checked through all of
I'll
ours.
make it up. I'll write
You'll
one
make
up.
one?
I'll make
Yeah.
myself a note.
Okay,
Job description. Sorry.
no worries. I
Alright,
honestly forgot about it until tonight.
All right.
Okay.
Anything else about the recycle center before we move on? Okay. Unexpected subjects. Vin, you had something.
I'm sorry, I'm working without the advantage of an agenda, so I didn't realize that was the business. That was the question I was going to ask, was the recycle center, so we've
Oh.
done it, no problem.
Got it. Any other unexpected subjects from members of the board? Or the dog?
The dog, he's got a lot to say, but
That
doesn't.
dog out of the diner.
Good gosh. He'd love to be in the diner. So I sent out an email with some of the questions that the EDS, so I guess the EDS, the Economic Development or EDC committee, is hosting like a Q&A session. They've invited some department heads, public safety, us, building, and then put out on social media for members of the public to ask questions. And we got a copy of the questions. So I kind of went through and made notes, and I highlighted them in yellow, my notes, because the questions are all like kind of they're not going to be any on the fly questions. So if you have corrections you want to make, or if you want to add anything, or if there's any, you want to send it back to me, then we can get Kathy a final draft.
Gotcha. There's a farm document. Oh my gosh. And I know we've shared it before as part of the.
Yep.
You know what I'm talking about?
I know exactly what you're talking about.
What's it called? Farmers market.
Yep.
I think.
What to expect, quick.
Yes, I think
quick
giving
stuff.
them. Yeah, I think that's helpful. It's like what to expect, and it's from the perspective of a farmer's market.
Yeah, and I also found on the state's website, seeing a lot of the questions were kind of geared towards residential kitchens, it looked like.
Mhm.
I found a great, like, just 2-pager that I'm gonna get up onto our website for people who have questions, because there's, I think, a lot of confusion with what's a residential kitchen versus what's gonna be like wholesale, and what stipulations come along with that. And the 2-pager did a really good job just kind of breaking it down, and then gave reference points like within our code. So I think that's important on Thursday. If there's like a question that we don't know, we can just tell people where to find the code or what
Okay.
code to reference.
Yeah, and I think question 12, when they say, can we find a list of food items that can be made in our homes without a commercial certified kitchen? I think the only answer to that is, if you're making food for sale to the public, you need to have a certified kitchen, a residential kitchen permit. However, if you're making food for a potluck event, it is considered at your own risk. So,
Well, you can't, if you have a residential kitchen, you're not supposed to be making anything that's potentially hazardous.
correct, but the
period.
question isn't about what it's basically like, the question is too specific, and like ultimately there's a whole bunch of things you can't make. I think that part of it, the answer is correct, but ultimately what they're saying is, what can we make without a commercial certified kitchen? Well, if you're selling items to the public, nothing. If you are selling them and you have a residential kitchen permit, there are further restrictions. And then the only case in which there are no restrictions is when you're preparing items not for sale to the public, but as a potluck, as like a picnic, essentially.
Yeah, I'm familiar with most of that, Kate, because we've done and had discussions about that in the past. Thank you for your notes, Mallory. Do you guys have anything specific for me? I need to step out. Okay?
Nope. All
Thanks,
set.
Kathy.
All right, good night.
But otherwise, I thought all the answers were good. And the cottage food operations, well, and it's funny because there are like literally links, I think, for each one of these. I could probably give them.
Yeah, I
Right.
have a bunch of, I want to eventually redo our website, but I don't even have time to eat lunch most days right now. So
Yeah. I just-
getting all these documents out because there are a lot of questions.
Yeah.
The more we have out, the better.
I think if they, I read that. I read this whole thing that you sent out and earlier today, and I think that if they had something to go to that specifically was for each type of situation, which is probably where those regs are, and it'd be a lot easier for them to understand what they can and can't do.
Right.
But if you, like Kate said, I mean, if you use common sense, if you're going to cook something to sell at the fair, that's, you need a permit.
Yeah.
You
You
can't
need a
just,
residential kitchen, or it needs to be
Yeah.
a permitted food establishment of some
but
type, or a
if you're gonna
temporary.
make something to go to the barbecue down the Rod and Gun Club, I mean, that's just a, like chowder or whatever they serve down there. I mean, that's different. It's just a one time,
Yeah.
it's a potluck.
Rod and gun and potlucks are eat at your own risk.
Yeah.
Right.
And
Yeah.
usually they're pretty good.
Right.
So I don't
When
ever
you're-
feel like I'm eating at my own risk.
Yeah, when I'm purchasing something, whether it be at a bake sale or even at like a high-end restaurant, I never consider it to be a risk. So
Yeah.
that's, the only things that are food that you can sell without permits are the syrup, honey, and whole fruits and veggies.
Yeah.
And eggs, as long as they're kept to temperature.
But I think they'd find a lot of their answers that they're asking here in the regs.
Absolutely. Well, they're all there, but I mean,
They don't know where to find them,
Right. The common person's not going to know where to, but the documents that we have is it's easy enough to just highlight the section of the code and put it into Google and it pulls right up. So.
Right.
And if you don't have time to readdress this, I can go through and add some stuff if you'd like.
Yeah.
All right, I'll do that.
I love
Send
that.
it back to you. But yeah,
I guess too, I'll put it out to Kathy. I don't know if anyone else is available on Thursday if she's unable to make it. But if we have a good enough document, I'd be happy to stand in.
I love your answer to number 16, by the way.
Which one was that?
The Board of Health is in the business of safety, not pretty.
It's one of my favorite lines.
That's pretty funny. There you go. All right. So I'll take a peek through those and try to.
Sure. Yeah. Anything you want to add, the more we have, the better. I know these are supposed to be like everyone in the audience. And then when the question pertains to you, that your video mic comes on or whatever, but you never know with these Zooms, they can go.
Gotcha. And there's still a meeting, what is it, April 1st, right? For the special permits?
For one of them.
Oh, yeah. For one.
The following one will be the second meeting.
All right. Any other unexpected subjects?
I feel like I had something, but it's escaping me. That's okay.
All right. I'll take a motion to adjourn if ever anybody wants to make one.
So moved.
So moved. I'll second that. All right, we're all in favor.
Aye.
Yep.